Everybody. Hello, hello, hello. Welcome wherever you are, whenever you get a chance to watch this, listen to it. My name is Gifty. Welcome to the Baller Mom Canada page. This afternoon, while I'm here, I have a feature guest that we will be talking about a very important topic as parents with kids in the sports sector. It's very important that we understand all aspects of how we continue to support the kids. And one of the main topic that I've seen all the time whenever I'm in a game is always dealing with, healings, concussions, and the brains and how it works. So I have a doctor here that will be telling us a lot more about, what it means, how we can go ahead to understand it better, how do we support those that are gone through, how we can prevent it, and how we can continue to grow as a community. So thank you for those who are joining in now, and thank you for those that are going to be joining a little bit later. But I wanted to not talk too much, and I'm going to add in our guest who is going to go ahead and continue and join us with it. So Dr. Colleen, when you get a chance, I'm sending you the invite, but it has to be done. We need to, okay, it's telling me that you need the latest version of Instagram to join. So if you're able to update your app, that will be great. But in the meantime, I just want to see how everybody is doing. Those are joining. Hopefully everybody's having a good February so far. Happy Black History Month to those that are celebrating, learning, understanding, and continue to pave ways for those that are making sure that, the Black culture here in Canada, US, wherever it may be, continue to prosper, and thanking those before us for all the work that they have done. So thank you for joining. But today, as I said, the topic is definitely going to be about concussion. It's a very heavy topic to start off this season with, but I feel like it's very important to still talk about it just because it's something that we've all seen whenever we're in a game. And see what's going on with them. And all of us do this moment, like, are they okay? Are they going to be fine? And it makes it really, really hard to understand. And me not being the expert in it, I wanted to make sure that I bring on somebody who has that expertise to share to us what it is that we can learn from it. So here she is. Hello, Dr. Colleen. How are you? Good
Hi, how
afternoon.
are you? Good
Good. Thank
afternoon.
you. How's your day going so far?
Great, great. I just found out that my Instagram is not up to date on my iPad, so I switched to my phone.
That's okay. I know all
Mm,
these updates every now and then, right?
I
And who
know.
keep up? Every other month, something has to be updated. It's hard, and then
Exactly,
you don't get enough
exactly.
space, so one app has to be deleted in order to get another
It's
app.
always something.
I know. But yes, thank you so much for accepting to come here today and share some things that we as parents, those especially in the sports industry, can get a better grasp of how best we can help, whether it be our own kid or teammates or even coaches, understand such a heavy topic, but well needed to be discussed. But without any
Okay.
further ado, I already mentioned your name. I'll give you the platform to introduce yourself.
Thank you. Thank you for having me. So my name is Dr. Colleen Prendergast. I'm a licensed chiropractor, concussion specialist, nutrition, sports injury specialist. And I've been working for over 15 years. I started out, I did my schooling to become a chiropractor in France. So I also speak French. That was a great experience growing up in
Bonjour.
Canada and being able to go there. Bonjour. And then I stayed and worked for 10 years after that. So I lived there for almost 20 years and then decided to move back to Canada to be closer to family and allow my children to be able to experience living in Canada as well.
Nice.
So I work in Brampton, where I have my own clinic called Limitless Healing Center, and I work out of another clinic in Mississauga. So I have two places. One is mine, one where I work at someone else's clinic.
Balance it out. That's what we do,
Yeah.
right? It's
Yes.
good to know. Now, did you yourself grow up play sports at any time growing up or even currently doing it?
Yes. So I love basketball.
Okay.
I used to play, but and would run track, and then of course I had to make a choice at some point, and I was much better at track and had much better chances running. So I did pursue track and field to spend many hours at university, which I now do for my daughter as well. And I was able to, I'm fortunate to have a scholarship, and I went away to school to the University of Iowa, um, and was able to run there. And then from there, that's when I left and I went to France. I've been able to run for Canada when I was a junior, so all good experiences that allowed me to get to where I am today. Sports, it's a good vehicle to help us to get where we want to go.
I I second 100,000% on that. It's such a great avenue, not just being the athlete itself, but the life learning lessons that comes with it, which is what a lot of most of parents we're trying to make sure that our kids get that out of it. And I'm sure
Yes,
during your is different. It changes year over year, but
yes.
the underlying is the life lessons that comes out of it, whether you have a career in it or not. But there's
Mm,
something of just being an athlete and being active, and it's I've just
absolutely.
yeah.
Yeah, it teaches you so much. And it's actually thanks to that that I even ended up in France because I was fortunate enough. I had to redshirt one of my seasons, and I didn't really want to spend an extra fifth year doing nothing, taking classes for no reason. So they paid for me to go to France originally to learn French for half a semester, and then I came back to finish off school. So once that was over, I went back. So yeah, I am very grateful to my sports career and the people I've met and the opportunities that it's given me.
That's beautiful. I love it. Now, what that opportunity has lead you into is you mentioned a couple of different experiences, and I think in my post or I listed the hyphens, the slashes that you have, all the different beautiful accolades that you'll be able to accumulate on just being who you are. One of them is being a concussion management specialist. So, what is that?
Mhm. So a concussion management specialist, what that means is that you're able to manage and guide people when they have a concussion in terms of what to do, what not to do, even prevention. So the big thing we try and do now is baseline testing. And baseline testing is when you are able to measure where that person is prior to having an injury. So like in any baselines we do for testing for athletes. So you just see where you are cognitively, and it's not a comparison. I always tell people when I do it, it's not a comparison of you against other people. It's a comparison of you with you. So what that allows is that if God forbid you do have a concussion, we can now compare you to you in terms of how you're healing and what's your progression of getting back to the court or to the field or onto the track, as opposed to more so comparing you to a pool of people your
Mhm.
age, your sex, or whatever. So we can compare you to you, and it's a better guide to see how you're doing. And then, like I said, it's going through if you do have a concussion, guiding you on the thing, the research behind what we're doing and how people are getting better.
Mhm.
Sorry about that. My
That's okay.
computer
That's okay.
computer is ringing.
These things happen
A
when
guide.
it's all right.
Yes. So a better guide of what to do and what not to do, because sometimes I still hear things that are being done that we don't do anymore because that's what we did back when. But the research
Mhm.
shows new things that we should be doing. That's a better way of healing
I like
and treatment. So that's another thing that we do.
I like that. And you mentioned a key point where it's a measurement of you to you.
Hmm.
So it's not so of one person versus the other because everyone is unique and
Yes.
functionally and deal with certain things differently. So that's key point to understand for a lot of the
Yes.
coaches parents that will be listening or watching later that your assessment is not it's not an up to par like a combine of how high or how tall you are
No, no,
compared
no, right.
to your individual assessment for you of path that is going to help that particular athlete on that journey of working with you. But for
Absolutely.
when it comes to dealing with these injuries, because the assessment is to look or see where the person are should they occur any injury. You have a little bit of data or support to help them. Now,
Yes,
for
yes.
how can we be mindful of that in dealing with those that have already suffered, or we're not even sure if they have suffered, and we're like, oh, okay, I see, Dr. Colleen is there, my son, my daughter's, it's not all there from that game that day. Maybe I should take her there. Like, what can we look, or key points that we can look forward to make that call, so we can reach out to you to make that, uh, a very academic and very strategic support, so that we can be 100% sure, okay, it's just a simple fall, it's not that serious, or
Yes.
really is that.
Well, the first thing is with parents, you know your children. So if you see any changes in their behavior, if they're complaining of symptoms that they don't usually have, then those are all things to look at. Even if you take them out for a day or two, it's better to be safe than sorry, because in concussions, what you don't want is another subsequent injury prior to healing. So we don't focus so much on, of course, there's borderlines to that, but we don't focus so much on the amount of concussions. But like I said, there's sometimes you have to, but it's more, did you heal before the next concussion? So you
Okay.
want to avoid that. So out of precaution, you pull them out of the situation. That one game they're missing is not that important. Sometimes I know we feel like it is while we're in the moment, but it's not that important compared to the long-term consequences that you can have.
Mm-hmm.
And you just want to pull them out and get them checked out. And if they have had a baseline, then it's quite easy to check them out, compare, see where they're at, and then they might just need rest, because not every hit, of course, is a concussion.
Yeah.
But there are clear signs. If they have dizziness right away, if they feel nauseous, if they want to vomit, if noise and light become sensitive to them, those are all key signs that will indicate you might have a concussion. Sometimes you hear people, well, they didn't lose consciousness. That's still one that I hear quite a bit.
Yeah.
And if just because you didn't lose consciousness doesn't mean you didn't have a concussion.
Okay.
Many people have rather bad concussions without losing consciousness. And also you can get a concussion without even hitting your head.
Oh,
So if you
wow.
get a direct blow to the body, um, your brain, which is liquid inside of a hard skull, will hit within the inside. So if you stop abruptly, so in a screen, for example, with basketball, or in a car accident, you hit something hard and you get the whiplash in your neck, then you can still have a concussion, because whiplash is often associated with concussions. So you don't have to directly hit your head. That's another myth that some people believe, that, oh, well, I didn't hit my head, so I didn't have a concussion. You don't have to hit your head. You can hit your body and just have an abrupt stop. Also, if you go to the hospital and you get a CT scan
Mm-hmm.
and there's nothing there, that also does not indicate you do not have a concussion. When
Okay.
we do those tests, it's mainly for checking that there's nothing major above and beyond brain bleeding or anything else that needs urgent, immediate attention. But once you eliminate that, then you can still have a concussion.
Oh,
So those
wow.
are the things that you need to look at.
Look at.
Yes,
Okay. I
increasing
think,
headaches,
yeah.
increasing fatigue, things that are all out of the normal for that person,
Okay.
and that onset of these symptoms come on. And sometimes it may not be right as the concussion happens. It can be within an hour or two after, or even 24 hours. Still signs of a concussion.
Okay. I like I like the fact that you emphasize about hitting your head on the ground,
Mm,
hitting your head against somebody. There's different
yes.
ways that it affects what's going on in the head. And the key point you said is we know our kids better. So we know
Mm,
if what they're saying is an actual complaint,
hmm
or something that's valid.
hmm
But we do have to focus on communicating with them to assess, what it is that they're complaining about, or what they're talking to us about, and how the change in behavior. Like you said, even sensitivity to noise
hmm
and sound and lights or anything like that
Yes. Yeah.
to watch out for. So for us parents, that's something, that's one of my takeaways, to be
Yeah.
more incline and pay attention to those, especially in just overall, not even just in the competition or anything, but just overall.
Yes, because we'll ask that not only to parents. So if I have someone who has a motor vehicle accident and they have their spouse or sibling or anyone that's coming with them, we will ask, do you see any significant changes in their behavior?
Mm-hmm.
And they can answer, said, well, yes, they do seem a little bit more agitated. They do seem more fatigued, or more slowed down. All the things that sometimes people don't realize that they've changed themselves due to the concussion.
Right. Wow. And for some of us that are currently in sports, what some of the mainly coaches, I would say, because
Mm-hmm.
parents, we see it, we're on the sideline, let's say in an active game, we're on the
Mm-hmm.
sideline, so get hit or fall down, we're like, ooh, and you get all that noise.
Yeah.
We hope you're okay. They slowly get up, you clap, and they go. For the immediate contact that has with them, the coaches, the trainers
Mm-hmm.
with them, what are some things that you feel like they can do right away to sort of secure that person or that player to be okay, so that when they come to the parents, we can take those steps that you talked about? Because sometimes I feel some things you do right away could impact,
Mm-hmm.
could be so.
Absolutely.
Speaking to the coaches, the trainers, or even the refs or those officiators are closer to these individuals on set right away, what's something that they could be aware of, do to help minimize any long-term injuries?
Absolutely. Well, first thing is making sure that your coaches and any staff that's there are trained, at least a minimum, on what to look for.
Yeah.
That's the first step.
Yes.
Because if they don't, then, not all venues, as I'm sure you've seen, have medical staff.
Yep.
So having
Not
your coaches, at
all, I
least
think all of them. Sadly.
I've seen some. So,
I,
but just making sure that at least your immediate staff knows what to do, what not to do.
mhm.
And when I spoke about the baseline, so the system that I use that called Complete Concussion Management, they have an app which is actually pretty good that I've seen it evolve over the last couple of years. And when you are in the system, the coaches have access. So they can, on the sideline, check right away, have a checklist of what to do, questions to ask, and then they can alert myself or whoever is in the system, whoever their head lead is, about an injury, and then getting them in to be checked out as quickly as possible. So
Okay.
that's one thing that you can do, get them trained. And then if you do have this system baseline and they're registered, you can get them in to see someone right away. So
Nice.
that's important. And then just be very observant, is as parents, to watch any changes in symptoms.
Mm.
So the old adage, here's another myth, is that you have to wake them up every 2 hours. We don't do that anymore. Um, the fatigue that will happen, because when you have a concussion, it's an energy drop. Okay, so it's more like an electrical storm as opposed to you feeling a bruise in your leg or in another part of your body. So when you have this energy drop, it can cause fatigue. So you want to let the athlete sleep. Let them sleep. But you, as the parent, now are going to lose sleep because you're going to watch them,
Yeah.
make sure they're okay,
Yeah.
watch that they're breathing, make sure that everything's okay. But let them sleep. They need that sleep. Waking them up is actually going to be counterproductive in terms of what you're trying to do, in terms of letting them recuperate and get rest.
Okay.
So
Wow.
those were the things that you want to do when you go home. Make sure they hydrate, and stay away from nutrition is going to be a huge part of that as well. Staying
Yes.
away from junk food and refined sugars that can cause peaks in
Uh,
their blood sugar level that will be counterproductive to their healing as well.
yes. And talking about nutrition, we will recap another
Yes,
session, and we will definitely talk more about the nutrition aspect of it, not just for the kids, but even for
for the
ourselves.
parents, yes, it's important because our children copy what we do,
Yes,
and
I'm the one doing
and
shopping, so
yes,
yeah.
exactly. And that's why often we'll do training and information sessions for the kids, but also for the parents, because it's the parents that are cooking and that are buying. So if you
Yeah.
don't know, you don't realize, you don't mean to, but sometimes you get things because you're
It's all,
busy. Yeah, it's ease, it's you're trying to make them happy. It's a bunch of things. So just finding a middle ground. And in the concussion training, we have to recertify every couple of years. And I really noticed this last year, the high component of nutrition in terms of healing your concussion. So it's always been there, but this last portion was the concussion portion really increased. So it's very, very important to all forms of injury healing, overall health, and concussion.
Because what we put in our body is what's going to help heal it and eventually make us feel better.
Let
Okay, I'm learning. I'm learning.
yes, let food be thy medicine. Yes,
I
doctor.
like that. Okay, so also for um, immediate versus long-term impacts for any app
Yes.
that they've come to you and you've assessed it and you say, okay, yeah, you have suffered it. We're going to go
Mm-hmm.
through these treatments with you.
Mm-hmm.
What are some of the short-term impacts or long-term impacts where they're left untreated or fully treated? Because everybody heals different, a different path. Uh,
Yes,
if
100%.
overall or the myth surrounding this, if you get concussion, oh my God, you're incomparable, you can't talk no more, you can't move.
Mm.
There's all these, maybe Hollywood and all these movies just exaggerated and
Yeah.
all. From a medical perspective, from a parent's perspective, what are some functionality things that you can see that somebody can have it, but they're still living a good life, even though it may be a long term, so that it takes away that myth from us or that fear that we don't want to jump on it because it's the unknown and that
Yes.
I don't know if you know what I mean, right?
Yeah, no, I understand. So one of the first things I would say is that as you're going through this process is that absence of symptoms doesn't mean absence of concussion. So if someone had sensitivity to light, sensitivity to noise, headaches, and now all of that's gone, depending on a minimum amount of time period, doesn't mean that they no longer are concussed or that they're completely healed. This is why I repeat, the baseline is such a good thing because then you can compare them to where they are. And there's a set of steps and highly researched tests, like the treadmill test that we'll do once we've established that you have a concussion. That's a blood flow test to allow you to see where you're at, because actually moving and exercising can be good for you if it's done the right way and in a controlled way. So
Mhm.
that's something that can help to avoid. But like in a lot of injuries, sometimes we sit and when we get back, we're worse off than
Yes,
when we got injured originally. So you have
yeah,
to find that balance between keep moving and not doing too much so that you don't go backwards and you have much farther to go. So I say in terms of avoiding long-term social isolation, we
okay,
don't need to put someone in a dark room away from everyone. Reduce light if they have light sensitivity, but don't stay in there forever because then it's going to make it harder when they have to come back to the light.
okay,
Um, Allow them to live, do things, be around people, but in moderation. Moderation is probably the key word in terms of what you're doing. So symptoms are not an absence of concussion, that you're completely healed, and moderation in the things that you do, so that you're not going too fast and then you take one step, two step forward and go back three or four. It's better to slowly, and even when you're doing everything right,
yeah,
sometimes you'll go backwards, but it's not the end of the world. Just as long as you're aware of it,
okay,
you realize what you've done, and then you improve on it, and you're taking care of your nutrition, your health. But the social component is also very key. Is
okay,
that you have to feel like you're supported. So earlier you mentioned what can coaches and family do is just make sure that the athlete or your loved one, whoever it might be, feels supported. Because what I found for a lot of patients is that because they're not on a crutch or
yeah,
they don't have a boot or something that's visible to people,
yeah,
they are often not taken seriously.
yeah,
And it is very serious because the long term effects, as you said, can be difficulty in school learning, difficulty learning new tasks, and it can be a handicap to a lot of people. Even going to social events, even though you want to, you
hmm,
can't stay very long, you miss out on things. And then just it can create depression because you feel like nobody understands you. So just being mindful of the long-term effects and that some people might take longer than others,
yep,
and that just to be kind and let
yeah,
them take their time and heal. And just because Margaret healed in 2 3 weeks, Janet might take 2, 3 months, depending on their past history,
Mm-hmm.
their past mental state,
Mm-hmm.
um, the type of injury. There's so many factors that go into place. So you
Right.
can't compare Margaret to Janet in terms of how they're healing. So just in terms of taking care of that. But if the repercussions of not doing it properly can
Yeah.
be long, and you can have children that struggle if we don't take the time. Like I said, I repeat, that basketball game, as important as it seems, is not that important in terms of
If you
the
miss
long
one,
term.
yeah,
Yeah.
and that's key. That's fine. We had to go through that this weekend with my youngest. Like I was telling you,
Yeah.
it was one of the hardest decisions in all of his so-called young life when it
Yes.
came. But he had to. Like he could
Yeah.
barely move. I'm like,
Yeah.
you had to. Just you needed to heal. You're not doing
Yes.
yourself or your team any service if you're
Exactly.
moping, and like he just had to. But it's a lesson learned. But I agree
Yes.
with you. Um, Understanding where that person is and being
Hmm.
mindful and being kind.
Yeah.
Kind. It's so hard because I think in some ways it's harder depending on who the person is. If they're used to always be a go, 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 and that
Hmm.
their behavior, they're a little bit down. So that's one of the key factors to sort of understand. Or they still go, 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 but there's a little bit trickiness to it. So
Exactly.
what I'm getting from this is just be more observant and aware of anybody that may have any major traumatic or minor changes in their behavior.
Yes,
Um,
and it really, like I said, it can have a huge effect on families, on individuals, and that's the only thing I can't stress enough is that we need to take concussions seriously.
yeah,
Um,
I
Even if you see someone walking around and they appear normal, like I said, I think that's the hardest thing for people is that they don't see the crutch, the boot, and they just have
there's
difficulty
not
conceiving. Yeah.
dent, there's no blood, there's
Yes,
nothing.
yes. There's no cut. It's in their head, but it's not in their head. It's
Mhm.
real,
Yeah,
So just to know that.
yeah, I like that. And then for as a sports community, how can we also educate those that, well, you already talked about how those who are experiencing it and going through it, and some people may not talk about it,
Mm,
but let's say speaking in a team perspective, how can coaches make this sort of a normal conversation so that there's no cast out type of thing,
yes.
go out in or somebody, because it could be a private thing, but you also
Hmm.
need to be active in the team. So some things that maybe a sensitivity thinking or training that you will recommend coaches and organizers or admins or team managers that could sort of incorporate in it, that makes it like this is possible that one of us could experience it at any moment, but when it does, we're still a team. That without making it too, I don't know, ironing somebody out separately.
Yeah,
You know,
yeah.
it's
I hear what you're saying. I think it goes back to education because the education sessions I've done with coaches or with teams, often there's always people like, oh, okay, I didn't know that because we know what it means because we're going off of what we knew 5, 10, 15 years ago. It's just changing monthly
mm,
or yearly. So just um if the athletes realize that they're supported by their coaches, they will report their injuries. Because sometimes you don't even see it. You don't realize, especially in basketball, you don't realize somebody got hit.
no.
But if the athletes know and are aware and know that they can report it and be in a safe space,
Mhm.
then they will talk about it more. And if coaches are aware of what it entails and just knowing how it works, as I mentioned about the energy shift and all of those different things, then they will also be more aware of it and do better. Do you know what I mean?
Yeah.
So I think it's all about, comes down to education and informing like many things. And as long as we let people know what it entails, what are some of the signs and symptoms that they might have to look for, and just understanding that it's not the end of the world, but if, like in any injury, the quicker you deal with it, the
The,
better you'll be, right? Because I have people who will come in and they had a concussion 5 years ago, but they never really dealt with it. But you can see the side effects of what they're dealing with today.
yeah.
And it's a shame. And you can still help them, they can still get better, but it's just more difficult,
It
right?
be a
Because
long.
if they had dealt with it right away, because you were afraid of missing that game, you were afraid of you getting benched, you were afraid of being criticized, called soft, or all of those different things. So I think it's a group effort, informing the coaches, and then the coaches supporting the information being given to the
Mhm.
athletes, to just let them know that we're here for you. Don't worry. Let us know, and then I think that will allow for better treatment and what's the word?
Healing.
Identification. Yeah, healing, identification, and healing of those symptoms.
Yes.
Absolutely.
You also did mention throughout about how you work with teams or coaches, and
Mm-hmm.
you have a lot of coaches that follow, or do a lot of clubs that follow, and everything. So if there's a new team or coach or anybody that's looking for these services, you know, walk us through how you work with them to be part, to incorporate your services into their team to make sure that all the services you provide is also helping their club, not just come practice, dribble, game, and go, but build
Yes,
whole communities. So just walk us through what your processes are, and how they can also reach out to you to make sure that your program is one that they can definitely reach out to be incorporated into their club.
absolutely. So I'm really passionate about prevention, because a lot of things can be avoided. Can't avoid everything, but half the time, if we knew, knowing is half the battle. If we knew, and we knew where to go, because sometimes people just don't know where to go.
Yes.
So it's about informing coaches and players about what you can do, what's out there, what's available to
Hmm.
them. So it starts out with information sessions, training sessions with coaches to let them know about concussions, working with teams, knowing that they have somewhere to go, that has the experience of working with athletes. And I was an athlete myself, still am, try to keep going and competing. Um, but just knowing that there's someone who understands what you're going through, as opposed to someone who's telling you something, but they didn't necessarily do it themselves,
Hmm.
who's around the sport. So just my services are to help and guide coaches and programs so that they can implement things that would be better processes that will um, help their athletes to avoid injury and get treatment quickly. And in that goes through the concussion training, that goes through injury and strength performance, because I have a network of people that are very good, that do a lot of strength training, and exercises that help to prevent injuries. Once again, so you'll hear me say prevent a lot, because we can avoid a lot of things. And then also with nutrition, because once again, if we eat well, how we fuel the body is how we live. So if we fuel, like with a car, if we put in the wrong gas, the car is not going to run properly.
Nope.
So if we eat properly, we can also avoid injuries. So
Yes.
that's how I try and work with teams to make sure that everybody's doing well and
Mhm.
they're on top of things. I love seeing high performance, seeing kids do well, especially when they come from the beginnings and they grow,
Yeah.
and even just seeing people come back from injuries and breaking records. So
I love that. And for the age group, what is the age group that you service to?
all
Because how soon,
all
too soon,
all
or
the
late,
sooner the better,
sooner
all
the
age
better.
groups, because what you teach a child and teach them in terms of how they eat and what they're doing
Mhm.
early will go with them, and they will know better later, right?
Yeah.
So actually, the grassroots, the earlier you get in, the better it is. I mean, obviously you're going to change it in terms of how you gauge them and how you teach them.
Yes.
But for example, a lot of these kids that are in age groups that want to go away to school, if you don't teach them now, when they go away, they're on their own.
Hmm.
So if they know what to look for in high school as they're doing OSBA or OBA or whatever level, and then they go away to school, they already know what to do.
Yeah.
Um, Once they get away, because they've been trained, they know what to do. They know how to prevent injury. They know what they should and shouldn't be eating. So I want to say that it's all levels. I love high performance and older athletes,
Yeah.
but at the same time, to get to that and get to that quicker is if you know what to do early.
Oh man,
So
I'm so happy. I'm gonna be bring in my boys there too. But I think you touch on the key point because we have to make sure that they know what to do with
Yes.
their and understand it, as opposed to somebody telling them, right?
Yes.
So the fact that you are incorporating both coaches in there and showing them the program and the
Yes.
process, they too can then better analyze, oh, hold on, this
Mm-hmm.
is not good or this is good or whatever. And sometimes some kids may be hurt, but they still want to play, and the coach can make that call because they've been with you and you've
Mm-hmm.
given them the key and things to
Yeah.
look or say, no, I'm going to make that call. Sit down, heal
Yeah.
first. It's not about winning or anything like that. And then the kids understanding that, when I feel a pinch, this is how far I can push myself versus not.
Yeah.
And it's
Yes. And
myself.
we talk about that balance too, because you have to learn to be able to push through some things, right?
Yeah,
You're not going to stop at every little thing, but just knowing your body and
yeah,
knowing when to stop and when you can push through. Because if you miss this game, you'll be there for the championships. But if you push through this and then
you
that's it,
miss
and then
out.
you're sitting,
Yeah,
yeah. So it's just knowing when to balance out. We don't always get it 100% right. We're not perfect, right?
no.
But once you go through it, you can kind of figure it out.
I like that. Okay, good. So for the coaches, the clubs, the admins, team managers, definitely reach out to Dr. Colleen and her team. Add these conditionings, support to your
Hmm.
program. I mean, we've been
Yeah.
paying for everything as it is. I will personally be okay if all of these type of services are added as
Hmm.
part of the program because you don't want to focus on just come practice, play, practice, play. We're building
Yeah.
a holistic human being who are
Exactly.
also an athlete. So it's not the only
Exactly.
these services that you're providing is it's so needed. I'm so and I think in the maybe based on how we see on TV, you've always seen like pros having their own,
Hmm.
but the fact that you talk about even grassroots level
Hmm.
where you can get these services at an onset beginning is key and it's
Hmm.
important because we're building that and you're structuring their brain, their mindset, their behavior in the early stages so that wherever it may lead them is part of their life and it makes
Exactly.
it easier.
Absolutely. I mean, I wish I knew a lot more of what I know now when I was competing, but that's life. But there's one thing my mom, I give her a lot of credit for that, is that mom used to always cook. I have a Jamaican mother that would cook on Sundays after church and spent
Prepare.
the entire Sunday prepare for the week. And I just grew up learning and liking to have the good home cooked meal. So when I went away to school in the U.S., a lot of my friends, American friends, would come over and would be surprised that I was cooking. I would just repeat what mom did. And I
Hmm.
would cook when we had time, if we didn't have competitions. And they were surprised, like, who's coming over? I just remember those stories, and I'd say, nobody. I was
So,
doing it for myself, but it just didn't seem like it wasn't normal to them that I was cooking all this food. And I think it really made a difference for me over the years to have that kind of training. And then living in France, that was just another experience because they're so big on food and the
mhm.
quality of food, and so it's
you're
cultural for them.
you're set. I like that. Good job, mom. And you had a student that was willing to learn, so
Yes,
obviously we right.
yes,
It's different doing the cooking and they're like, yeah, okay,
yes, yes,
I'm still working
exactly.
on that. Um, I also noticed that we talked a little bit more about the teams, um, the services you provide for the teams.
Hmm.
Can you tell us the overall benefits that it provides for the athlete level? Because some coaches will be like, I can't add this to it as additional fee. Parents are going to complain, but
Hmm.
tell it to us on the benefits of it. Because sometimes when we don't see the benefit, we kind of cut ourselves off and
Hmm.
thinking more the negative side of it. And these, like I said, this is services that's definitely well needed, not just even in basketball,
Yes.
overall in a family settings or any sports that you need. So on the beneficial side of it, give us a little bit more emphasis on this because I want that key point to stick out for anybody that has any doubt that the benefits outweigh the complaints.
Well, I guess I would go for the phrase that you hear, either you take care of your health now, or your health will force you to take care of it. And it's usually not at a moment when you are neither prepared for it nor have the money for it.
Mhm.
So, yes, it's expensive. I agree. But there's always ways to get through and find. And I also compare it to, it's like your teeth. We know that going to the dentist can be very expensive, but when you do maintenance, you have less issues. You find those problems earlier. So everything you're doing is a build up towards your future career or just overall health,
Mm-hmm.
mentally, physically, and all of that. So when you do it, there's packages. There's always ways to get around it
Yes.
and to make sure that you're doing well, because when you're healthy, you can go farther, right? But when you don't do it, now you're catching up anyway, and you have no choice, because if you don't do it, and in the end, it does cost you more. So it's kind of, what are you willing to put in now
Mm-hmm.
in order to have the benefits? It's all about knowing where you want to go, right? So I think it's more of a question of coaches, from the ones that I've worked with, some just put things in and they say that, and that's just the way it is, and they find ways to incorporate it, and parents in the end are happy about it.
Yeah.
um, you'll get people who complain, but I mean, you can't worry about that, right?
Oh,
Or you find solution for those that can't afford it, because sometimes that can be an issue. I'm just talking about grocery prices right now, don't even get
no.
me started. But I like that my children sometimes come with me, and even they're surprised at the price of the grocery bill when they look at what's in the cart.
It's a long,
Healthy.
isn't it? Or is it just mine?
It's very expensive for very little that's in the cart, and
Yeah.
so they realize that it costs a lot more to eat healthy, right? But like in anything, at the end of the day, what you're doing now will pay off in the
In
end,
the
right?
end. Yeah.
So it's more just getting coaches to understand, explaining it to parents. I like explaining it to parents, explaining it to coaches, letting them know what they're going to get. And then most of the time, they're okay with it.
I like
Honestly, they are usually okay with it.
good, good, good. And overall, with all of the experience that you've had, give us some of your proudest moments because you're doing
Mm,
service. You're a mom. You're an athlete. I wouldn't say former because you're still active, which is awesome. So you're always speaking from experience and all, but it doesn't have to be about the sports industry or even your field, but just something that makes you most proudest moment as Dr. Colleen Pendergrass.
I think it's just seeing the athletes succeed, seeing the girls and boys just graduate, and when you see someone later on see what they're doing when you knew them. So I've had students come to the office, even when I was in France, to do co-op, and then they graduate, and some have become chiropractors. Makes you feel old
Wow.
because you saw them when they were a student. So, and then they become a colleague. So that's probably some of my proudest moments, knowing that someone started off as a patient, that I encouraged them or inspired them to also do this profession, and then they've gone through and they've become a chiropractor. Is one that I find is very important, because that means that they saw my passion in what I do.
Hmm.
And the other one would be to see an athlete that was injured and then see them come back from that injury. But I was a little bit a part of that, and then now they're succeeding in their sport and life. And so it's all about making it through, because we're all going to fall down, right? So it's just seeing them be
For
able
sure.
to continue. Yeah.
Oh, that's so beautiful. And honestly, I think there's one particular patient you mentioned her name that I think treated, and they spoken really well, highly of you,
Oh, thank you.
and then listening, and just getting it, and you get it. So, which is good because these kids these days talk different language, but you get it. That's what
Yes. Yeah.
I was like. It's good. So you're cool with it, which is a good thing.
Yeah.
Because
Thank
you have to
you.
be on the same some sort of a understanding when we're talking with them.
Yes.
But we do definitely appreciate the work that you're doing in helping not just even the sports sector, but just
Mm.
overall health because it's what's February now, January, everybody's starting
Yeah.
new year, new me, whatever. By March, people forget about it. But this is a
Yeah.
life thing, right? That we
It's a, yes, it definitely
so
is.
I think it's great that you're continuing to do that, and I'm definitely going to make sure everybody's continue to engage with you, reach out to you. You did mention there are two locations that they can reach out to you, but if you can just repeat that again towards the end for any people that may just chime in towards the end, and or some people like to skip through the end and say, "Where is she? How
Yeah.
can I connect with her?"
Yeah.
So you give us, your promotion, your gist of it. Where can we find you? How can we connect with you?
Well, you can find me in Brampton under my name of my company name, Limitless Healing Center.
Mhm.
I'm in not too far from downtown area. And I also work out of another clinic that's not my own in Mississauga called Momentum Healing Arts. So I can be found there through Instagram, Healing Limitlessly,
Mhm.
or on my website, limitlesshealingcenter.com.
Yep.
I can be found in both of those areas, and just please do reach out, ask questions. I don't mind.
Great. And then lastly, which is your word to say, because I always like to end off with some inspirational things that makes people feel like, well, I came on here, I listened, I learned something, but now I'm also inspired. So who or what inspires you?
There's so many different people. Mm, just I don't even know. It's there's so many people.
Good.
There's kids that I've seen get up and do better things. The list would be long, to be honest. My daughter inspires me because she's been through a lot, changed countries, and she keeps getting up. She still fights. So
Good,
that would
good.
be, even though she's a child, but she
Yep,
inspires me, you
great.
know.
And, Coach P saying hi, Colleen.
Um,
Yes, shout out to you
I
too, Coach
appreciate
P. I know all the work you're also doing to help the community, which I think is something that is well needed. And
Yes,
long overdue,
absolutely.
but well needed. And I really appreciate you taking your time, your lunch time to come on here, share
No
your,
problem.
give us great tips. I'm going to recap it and make sure that everybody finds a way to connect with you, especially for us in the Toronto area. You're
Hmm.
drive away to reach out, come to your office, get the support needed, and you're on the same level as you're a parent, you're an athlete, so at least that's a breakaway of the conversation that we can start off to make it
Yes.
go and get the help, whether it be for our kids or for ourselves. So truly, truly appreciate you coming on here today. Thank you. Is anything else you would like to say?
Oh, I just thank you for having me. And yes, I just pray that we can continue to help these kids, um, to continue to strive and not to get down. Because I just find that sometimes and then we get caught up as parents too, just take some of this too seriously. But at the end of the day, all of this sports is just to teach these kids how to persevere in this world, because things aren't always easy, but it's beautiful. It's
Yes.
beautiful, and as long as we keep going. And I think that was the one thing my dad taught me, was he always said, and stuck with me, it doesn't really matter what happens to you, it's how you react.
Oh,
So as long as
that
you
I like
keep,
that. You gave me
as
so
long
much
as
quotes today. I love it.
as long as you keep getting up and fighting, and I have to remind myself of that. And I saw pretty much the same version of the same thing from Denzel, where he said, "Fall down 7 times, get up 8." So it's the same thing. So things will happen, but you just got to keep going. And there's so many beautiful things that we can do. So just don't give up.
Don't
Just
give
don't
up.
give up.
All right, we'll leave it right there and then as the last word from you. Thank you so much, Dr.
Thank
Colleen.
you. Thank you again.
Thank you, everybody. Enjoy the rest of your day. And that will be end for here today. Bye.
Bye.
Okay, so thank you, everybody that tuned in. This concludes the Baltimore feature series here, where I had Dr. Colleen talk to us about understanding concussion, the myths surrounded by the proper way of healing, assessing, working with her and her organization, and sorry, her team, and making sure that there's a proper way to assess and support your child if and when they ever have to go through any of those. She has 2 locations that she currently works at, one that she owns and one that she works at. All the information will be shared shortly, but I want to just end it off to everybody that, as she said, don't give up and let's be kind to each other, because we truly do not know what anybody is going through. And the understanding of what goes on in the head is unique to each individual one of us. So for kids, for parents, for athletes, coaches, or anything like that, let's be mindful of how we are with each other, especially in a very highly competitive game. Everybody deals with different injuries differently, and whatever it may be, there's always a way to heal. And limitless healing with Dr. Colleen is definitely one of the practices that you can go to get the support if needed. She does have multiple different services she provided. We will talk a little bit more about it in a later days about some of the other services that she provides. But for today, it was mainly focusing on the idea of mental concussion, the support that's needed, how to assess it, and how her and her team can truly help you from a medical perspective to make sure that we are raising holistic children. Thank you for spending your lunch with me. This will be posted shortly on YouTube as well as translated into the podcast. And if anybody have any questions or support or questions that they have, I can always be reached at ballermomcanada@gmail or directly here on Instagram at ballermomcanada. Thank you and have a good day, guys. Bye.